Time now for another edition of Wellness Wednesday. We bring in Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave.
Well, we're going to talk about tools in the toolkit once again at Okoboji Wellness Clinic. And sometimes we get stuck on a topic and we forget about all the tools that are available at Okoboji Wellness Clinic. One of the things that you do is ozone IV, and then a lot of times what you do as well, I've noticed with that ozone IV, is you couple that with some high-dose vitamin C.
Absolutely, Dave. So lots of tools in the toolkit. You know, we get a lot of folks that come in, and what kind of ends up happening is, you know, in the traditional system in which I am part and trained, you end up with a particular problem in a particular area, and then you go off and see the specialist to address that particular area. The problem is a lot of times compartmentalization happens. So it's really good if there's an emergency and you need a stent or a bypass, those kinds of things. But many times we go and we're left with, you know, well, the blood pressure's too high, or we've got an abnormal rhythm, and here's the prescription, and it may address or lower that blood pressure. But many times folks that go in to see that specialist, there's a way to monitor and measure, okay, what they're doing, and is it creating change? And a lot of that it might be a blood pressure check. Sometimes it's blood work. Many times, though, it's conditions and symptoms come with whatever that thing is that they're addressing. And a lot of times those symptoms, maybe they get improved a little bit, but in totality, from a whole system across the board, head to toe, do you feel more vital? Do you feel more refreshed? And then sometimes those medications may come along with some side effects and adverse reactions. So we may just kind of hop to one specialist to the next for many folks over time, and then nobody is really putting the whole big picture together. And so that's what we do at the clinic, at Okoboji Wellness Clinic. Our team, compassionate, very amazing individuals that have been called into the healing arts and into the particular way that we approach things here at the Okoboji Wellness Clinic, which is this integrative model where we blend the traditional approaches along with holistic approaches, and those holistic approaches look at the whole system in totality. We work to not just think if somebody's coming in and saying, man, doc, I think my thyroid is out of whack. I think in my team, we go beyond thinking thyroid. We think, adrenals are a lot of times associated with a thyroid gland, and the adrenals sit above the kidneys. Many times, as we've talked about, digestion is in our microbiome, our nervous system, our level of stress, all of these things, the food that we eat, the movement that we have or don't have, all these things are connected. And then we look at our array of tools and determine what are the best tools to get all these systems connected and back online together at the same time. So I look at it as chain. If you think of a chain link fence or maybe just a chain that's got the links in it, if 3 or 4 of those links are out of position and not functioning well, those are the specific chains that many times folks, again, go to the specialist X, Y, or Z for. I'm looking at maybe we need to address all of those links in totality at the same time. And many times this can be through a supplement approach, again, through lifestyle changes. And then it's determining, okay, we got to get you out of pain. Pain's a big one. How well are you sleeping at night? If those things aren't happening, to get back onto that healing path, it's pretty doggone difficult. So we look at the mind, body, soul, and then we include these tools that are ever expanding. And my friend, one of our patients that comes from near Pocahontas, he says, I don't know, but this stuff just works. And when he was told this would have been last fall, he was in to see a medical provider, and that visit led him to get quite afraid because he was told that he might be in a wheelchair and lose mobility and not have the function he'd like to have the way things were going with him over the course of the next few years. Now, of course, he farms, and he could barely go out and pick rock in the field. And so this gentleman came to us, a lot of joint pain, and just very low energy. He just could not get to his workday. He had decreased physical stamina, couldn't lift very well. And so, of course, all this affects everything. And so, to your point, one of the big things in the tools in the toolkit that we often reach for are the metabolic boosters. And a lot of these treatments, whether or not they're hyperbaric therapy or they're something like ozone therapy, we reach for those metabolic boosters, those things we've talked about quite a bit with the mitochondria. And whatever is working to boost that mitochondria is a very positive thing. And so in the case of this gentleman, I think we've done some platelet therapy called our True Dose, and we have done IV ozone, IV vitamin C. We've really revamped his diet. He's worked with Molly, our functional nutritionist, and he is working with Mychal Sheridan on balancing out the nervous system, and he's some astounding results. And he's going to be one that he's agreed to come on and talk on one of these mornings on the Wednesday morning to share his story because it's quite impactful. And he's like, I wouldn't even have thought of taking a vacation, and he said he's doing things now that he would have thought twice about doing before. Like he just gets up and does the physical tasks that he needs to have done, and he just does them now without even thinking about it because he's not having the physical limitations. So he said, this blank works. That's what he said about the ozone. And he's like, I don't quite understand it, but it works. And so typically we're going with a series. A lot of times we'll have folks come in like we have with him 2 to 3 times a week, and we do a lot of build. We give a bolus on these different things that are metabolic boosters, and then we look at the prescriptions that they may be on, and are we able to wean off some of those prescriptions over time? But the ozone, it is 3 oxygen molecules, and like I've shared before, it's like bubblegum shrimp. We can give it a multitude of different ways. Many times I'll do it with joints, injecting into different parts into the back, carpal tunnels, into knees, shoulders. And it's typically a series of injections. But the IV part in particular just seems to work so well. It works on the immune system, and it bolsters that immune system, and it works on the ATP production of the mitochondria. It works on the cytokines, and so it has this whole, and it's antimicrobial. So a lot of times folks that have chronic pain, which is pretty interesting, is they have some chronic underlying infection somewhere. So if they were to go on an antibiotic for a little bit of time, they might notice, wow, my pain is much better. That's probably because they've got some degree of some little bit of infection that's not giving them a fever or not sending them to the hospital, but it's just there. And so sometimes that's an infection in the mouth. Somebody will be on some, say, amoxicillin for a week and say, oh, wow, doc, and all of a sudden I was on that amoxicillin for a week and my pain everywhere got better. So the ozone in particular, it's rocket fuel, in my opinion, to just bolster energy. And so we see so many folks that it has some properties that work like an antibiotic in many ways because it's antimicrobial. So you can do PubMed search up and look up ozone therapy and the effects it has on viruses, bacteria. And so that's essentially when you do a series of things, instead of doing an antibiotic per se, which can impact the gut and the microbiome and get rid of a lot of the good stuff that we like down there and want to keep. That's not the case with the ozone. The ozone is very complementary to a healthy microbiome. In fact, many times there's a particular type of ozone that you can even take orally in a supplement form that's a slow release that can highly impact the happiness of gut flora. And one of the conferences recently out in California last fall talked about the studies that were showing that the microbiome was being enhanced by taking this slow-release ozone capsule daily. So, again, happy. It's such a gratifying thing to see folks that have been piecemealing things together, getting by, and you kind of look at the whole big picture, identify the individual's biggest concerns first. And, okay, what are your top 3 or 4 goals? because those are the ones oftentimes that we really want to focus on the most, and including the things that are important like pain and sleep. And then you pull from these tools in the toolkit, hyperbaric therapy, which is increased atmospheric pressure, increasing oxygenation to the tissue. We had, Dave, a couple that had come up. This is a kind of a cool story from Florida, and they were spending a week in June up here in the Lakes region visiting friends, and he's in his mid-80s. He's actually from I believe, Boston, and then they're in Florida as well. But his wife, he's mid-80s and had horrible chronic swelling and pain, and he did a series of 10 to 20, I believe, hyperbaric treatments, which is 80 minutes long, sitting in our comfortable hyperbaric chambers that look like a tent. You get to recline, pillow blanket service. And when he was not familiar with holistic integrative approach on anything, he'd been nothing but traditional his whole life. And I learned that he wasn't completely sure about what this was all about when he started, but he agreed to do the series of 10 to 20 hyperbarics. And at the end of it, he was astounded. Swelling and inflammation went down in his body, and to the point now where he is going to be looking to do that when he's in Florida. And his wife, who had dealt with chronic pain and inflammation her whole life, I made a whole bunch of recommendations. Unfortunately, they were only with us a month. Major impact with hyperbaric therapy for her as well on reducing inflammation, ramping up the metabolic boost. And we made some dietary changes. For her, I thought gluten was going to be a big trigger, and potentially do. But she did the hyperbarics, and she cut out the gluten, and I've been off to seeing all the specialists, and we love our specialists. I think they're great. But she's like, why did nobody talk to me about my nutrition and gluten, for instance? And so a few tweaks in her diet, and she has had 30 to 40 years plus of chronic pain. Now she's going to be going down this whole new rabbit hole because, again, all she had ever done was traditionally, all right, she had never been exposed to all the tool, buddy, because it is important. There's so many folks, you just assume that they know this stuff. I didn't know this stuff. 5 years ago, 6 years ago, practicing nothing but traditional medicine, which is procedural, surgical, pharmaceutical-based. And like I say, I still do that. I still practice procedurally and prescribe antibiotic when needed, that kind of thing, blood pressure medicine sometime when I need it. But there's just so many folks out there that they haven't had the exposure to it. And so that's the beauty of, again, being on with you on Wellness Wednesdays, having the word of mouth, the testimonials, because sometimes because I live in this environment now, the environment I didn't used to live in, with all these new tools that we continue to develop. And so that it's very important for folks that are out there struggling to realize that they don't have to struggle.
Right.
We got a team of compassionate nurses and healthcare professionals. It's so cool. Even something else that's going to be getting into this fall is biomagnetism. And Janet is gentle. She's such a sweetheart. She's so gifted. She does our craniosacral massage, but she is so gifted with her hands. And we were at this training back in March in Nashville with a bunch of MDs and DOs, and Dr. Garcia, he's an MD out in New Jersey, and he was talking about all the applications of biomagnetism. He went to learn it in Mexico, and so we're bringing that to the clinic here as well. And some of the initial findings with it are pretty astounding, Dave, that can impact things like inflammation, pain, some things that would actually blow your mind. And traditionally trained doctors are doing these things. You would never guess that. But let's continue to add tools to the toolkit. Let's continue to ask questions. And then it's identifying, okay, what is going to be the best set of tools for you? Because not everybody's the same. But let's remember, there is hope.
Yeah.
And you can feel better.
One thing I love where in the past 5-6 years that I think the medical field has been pushed is that the model that you have, thrive, not just survive. I think people have gone into that mode. I think people have gotten themselves the ability to do massive research on their own. I think people have gotten the ability to have a dialogue with their doctor, and people are moving past just the survival stage. They want to thrive. They want to live the day.
You're right, Dave, and I absolutely encourage that because I learn from our patients that come in every day. It's impossible for me to know everything. That's why I have a great team around me. I continue to go learn and go to conferences and build. But there are things that with the availability of all the things online now, of course, it's important to know how to data check that and make sure it's accurate, and it gets us asking the right questions. And I think traditionally over the years, you always just whatever your medical provider says, you just go with. But in my opinion, it really should be a dialogue because it's the individual's own mind, body, soul, their own vessel and options.
Right.
And ultimately, it's still up to the individual that's that informed consent to make those decisions with the proper information they're given from their medical professional. And hopefully that medical professional is open-minded and is always digging and researching themselves to look into new ways to help their patient get onto the path of healing.
Right.
And thrive, not survive. We don't want to always just manage stuff. Our goal really should be to get somebody to the point of where they're completely over whatever that chronic illness is.
Yeah, we got to run here. If people want to begin their journey thriving, not just surviving, how do they get a hold of you at Okoboji Wellness Clinic?
Give us a call at 712-339-6024. We're at right next to Ace Hardware and across from Quick Star off Highway 71 in Spirit Lake, 3305 Berquist Avenue. Again, we do a free discovery call, 15 minutes. Molly Avery does that. So does Mychal Sheridan, myself, to talk about the services that we offer. Some folks decide they want to start narrow and kind of baby step things. Other folks want to go wide and throw what we call the proverbial kitchen sink at it, like I did during COVID. I was like, all right, we need some more than just this. We need that and that. And so some folks want to do that, and that's okay. And we're here to provide those options for you and to cheerlead and to give you the support you need as you move forward. So give us a call, and you can give us a call too if you're just ready to make that appointment and get started. If you want to get going on some prolozone injections, to the ozone injections. I don't want to just deal with this. It hurts when I go up and down the stairs of this knee, and maybe I'd rather try something besides cortisone. Let's try something that's antimicrobial, anti-inflammatory, and in many cases can get us to the finish line in incredible ways. Give us a call. We are ready to work with you and help you, like we say, thrive, not just survive.
Very good. Dr. Meyer, thank you so much. Have a super day. We'll chat again soon.
Sounds great, Dave. Be well, everyone.
Thank you, Dr. Bradley Meyer at Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.